Well, welcome everyone. Uh, have a great webinar for you today. 2026 billing and coding changes. I'm super excited to have these two individuals on my screen, Pam Peterson and Stephen Anderson from the Total Patient Service Institute, and just really looking forward to having them here. Um, so before we jump into the main event today, just a little background on Rectangle Health. If you are new to us and you're here for the billing and coding webinar, we simplify HIPAA and OSHA compliance, reminders, patient engagement, payments to over 36,000 dental and medical practices through our practice management bridge solution. Um, so we have quite the hour for you planned today, but I did want to speak to a little bit of housekeeping, of course, like I always do. Um, Firstly, of course, the CE credit. If you are here for your CE credit, do not worry. You'll be receiving an email from us about 2 to 3 weeks after the event is over. So just be a little bit patient with us, but we will for sure get that out to you. We will also have an email that will go out with a link to all of the good stuff that you see here today, including the recording. We encourage you to be engaging throughout our presentation today. There's a couple of ways to do that. One is our Q&A. If you have any questions that come up, please ask them. We're more than happy to answer them today. This is going to be a very interactive webinar. And that's the way that Stephen and Pam like to do it, right?
Yes.
So please submit your questions and we'll have them for you, those answers for you. We also will have polling questions as well. We'll have three of those. This should not be new to anyone who's joined our webinars before. Again, we look to those polling results to see who's been interacting. We base our CE credit from there, so please interact. And then finally, our survey. Um, we want to hear from you. We want to learn what you thought about the session, what we could do differently as far as topics for next time. Do you want to hear from someone right away? All of that great stuff. This is your opportunity as soon as you exit the webinar today to let us know about those items. So please take the survey when you exit. It really helps us a lot. So with that being said, I do have a great pleasure of having both PM Peterson, Stephen Anderson here today. So Stephen has worked with professionals around the world to transform their practices, businesses, and their teams to the highest level of performance with innovative patient service systems that make it easier for patients to say yes to treatment. And Stephen has worked with some of the biggest names in dentistry to help build their practices. So welcome, Stephen. And of course, Pam Peterson. Pam is responsible for directing the activities of a large group of professional consultants and a client support team that advises and coaches dental practices all over the country. In addition, she provides executive coaching for the company's partnership offices to ensure that everything the consulting team recommends works and produces results. I couldn't be more happy to have you guys here today, and I'm so looking forward to this session. So, Pam and Stephen, take it away.
Thank you. Thank you, Derek. Good to be with you, and thanks for organizing and teeing all this up. I'm going to share my screen. We've got a lot to do today, and Pam, we can see that all right, correct?
Yes.
Good. So I'll just give everybody just a quick background so you understand who we are and context. So Pam and I both work together at the Total Patient Service Institute. Our education coaching company is committed to one word, and that is the word yes. So every point of the patient experience where you need a yes to move forward is what we do. And in today's context, this has everything to do with getting a yes to treatment, financial arrangements, and making sure you get a yes when you code things, when you code them correctly. So our team of coaches, as Derek mentioned, works all over the country every day, all 50 states, working hand in hand with practices to implement the highest level of patient service and case acceptance skills in dentistry. And our community that's grown over the years of practices that subscribe to our practice management philosophy is called the Crown Council, a nationwide network of practices committed to creating a culture of success in their practice. So On any given day, we're interacting with hundreds of practices all over the country, which gives us a unique insight into what's working, what's not working, what's changing. And we're going to share with you some of those changes today in the context of coding. So, what has changed for 2026? And we're going to couple that with trends. Coding changes are a bellwether. They're an indication of where dentistry is focused. When we change codes, codes are an indication of where things are headed, what other practices are doing, which might indicate some areas of focus for your practice as well. In 2026, there are 60 updates that include 31 additions, 14 revisions, 9 editorial changes, and 6 deletions. So that's a lot of moving parts. What we are going to focus on today is 3 primary areas of your practice: diagnostics and perio, implants and prosthetics, and sedation. So as we looked at all the codes and the code changes, most of the changes can relate to one or more of these 3 areas. So we're going to look at these in each of those areas. First, diagnostics and perio. Next, implants and prosthetics. And then next, sedation. And with each of those changes, Pam's going to go through the coding changes. And then I will cap it off with some trends, some things you might want to look at as a practice to help grow your practice. Bill it correctly. And then you also need to be doing it, actually doing the work to be able to bill it. So we'll talk about both coding changes and trends and strategy for how you can take advantage of where dentistry is going next. First question, slides. Will the slides be available after the webinar? Yes, this webinar is being recorded. Derek, I believe that the link to the recording will be sent to everybody who's registered for the webinar, so you will be able to access everything that we talk about today. All right, so with that, Pam, our first category, as I mentioned, we're going to go through each of these categories: diagnostics and perio, implants and prosthetics, sedation. This is kind of like a game show. So Pam, diagnostics for 100. All right, so let's take a look at some of the diagnostic coding changes that are teed up for 2026. Pam, all yours.
Sounds good. Thank you, Steve. All right, this is my favorite thing to do, so we can make this easy for them by being the messenger. So the first diagnostic code is the D0426. This is a collection and preparation of a saliva analysis, and the keyword is point of care. So this is not allowable when sent to a lab for analysis or reporting. It's actually used for screening to help educate and assess the patient's condition while in the office.
So Pam, an example of this would be, we have many practices we work with that actually have a phase contrast microscope in their office. They take a saliva sample, they put it on a microscope slide, they put it under the microscope so that the patient can see what's swimming around in their mouth. If you've never done, so I think this is the code for that. Is that correct, Pam?
That is correct.
Yeah, so this is a really interesting, we tested this many years ago. It's an amazing case acceptance tool in hygiene when people actually see what's really going on in their mouth, the little organisms that are swimming around. When you get educated up on this, it's fascinating to see healthy bacteria compared to bad bacteria and what it looks like under a microscope. It is an eye-opening experience. So apparently there's enough of that going on, Pam, that there is now a specific code for in-office collection and preparation of a saliva sample when you're looking at it under a microscope.
Absolutely. All right, so the 2 codes that will support the code that I just reviewed, the new one, these have been revised. And so the keywords that for revision that the Code Maintenance Committee removed or added is they removed the word diagnostic testing. So the first is the D0417. So this is a collection and preparation of a saliva sample in the office prior to sending to the laboratory. So this is the first code that you will use. And whether you use a swab or a rinse, this is the code that you will use. Following that is the D0418. This is the analysis sent to the laboratory for diagnostics.
So if you're doing salivary diagnostics, then there would be two codes, one for collecting the sample, and then two if you're charging the patient, right, for the analysis of the lab, then there would be a separate code for the actual lab charge for the analysis. So this brings up our first kind of trend question, which is salivary diagnostics. Obviously, with this change, that's an indication that there's some changes going on in this area. So does your practice do salivary diagnostics? There are a number of salivary diagnostic sources out there in dentistry today where you can make this as part of your Perio protocol. This is one that I particularly like, Simply Test by Spectrum Solutions, and the team there as a part of this webinar. If you are not doing salivary diagnostics, or if you're looking for a great resource, we're going to have a number of these today, so you can pull out your phone, scan this QR code, and the team at Simply Test will send you 5 free salivary diagnostic tests. We recommend using this like with a team. Have your team do it, send it in, get the report, see what it tells you. There's a whole body of work around this in terms of bacteria and its role in periodontal disease. But again, the changes in the codes for salivary diagnostics, there's a lot going on in this area. My view is that salivary diagnostics is rapidly becoming part of a comprehensive Perio protocol. If you're not doing this, highly recommend that you get educated up and learn about it. If you are, rock on, keep it going. I view the salivary diagnostics to dentistry is the same as a blood test to a primary care physician. So a big part of where dentistry is going next. Pam, let's talk about other diagnostic codes. Some of these are new. Some of them are ones that we find frequent mistakes. But let's see, in the area of exams, tell us what needs to be happening here.
So the D0160 is a exam code, and it's a second evaluation. So this is when an extensive treatment plan at the first exam needs a second appointment. And so you would bring the patient back and utilize a D0160. An example would be TMJ or severe periodontal disease, where the clinician needs to put together additional films, or even like the image you see on the screen, diagnostic cast, and bring the patient back. Now, with this code, the D0160, there are some frequency limitations. Some payers will lump it into the same category of the rest of your exam, so twice a year. And you'll hear me say this often: trust but verify. If you file insurance for your patients, please make sure that you add this to the list to see what the frequency limitations are. Now, frequently asked questions about the D0160 is, can you file this with an exam code? And although we are a yes company, I'm going to say no. This is a standalone code, and it must follow an exam code. So it's second. It was revised last year. And so if you see in orange sleep-related breathing disorders, you may add that to your list and bring the patient back. And a question that I'm asked often, another one regarding the D0160, can you just use this as a consult code? And the answer is, this is for a second appointment for problem focus. There is a consult code, so give me a moment while I go off track. That consult code is 9450, and it's typically not reimbursed. Practices use that so that they can track their treatment and their case presentations. So they use it for tracking and typically don't charge for that consult appointment. This one is an ADA code, the D0160, and you can attach a fee to it.
Pam, a couple of questions on this.
Okay.
This was from Erica Murphy. She said, if a patient comes in for a limited emergency exam and then comes back the next week with the same issue, do you use the 0160?
Yes. Yes. Because you can bring them back for a second appointment, and this is what you'll use. Now, I'm going to share with you another exam code, and we can make the decision if it's going to be the 160 or the one that I'm going to share shortly. So hang on for 1 second, Erica, and thank you for your question.
Okay, next one.
All right. The D0180, this is a periodontal comprehensive exam code. This is a standalone code, and this is to be used for patients who exhibit signs or symptoms of periodontal disease or have high risk factors, such as, just to name a few, um, diabetes, high cholesterol, hypertension, or if they have some social habits, such as smoking. They would fall under the category where you can utilize the D0180. It is a standalone code, and the frequency isn't is strict as the D0150. Many payers will allow this code twice a year, and always trust but verify. And when using this code, you must submit, whether you're in network or not, if you're filing on behalf of your patient, there are some key things that must follow this code, which is a 6-point measurement around every tooth. So a current perio evaluation measurement, bone loss, tracking bone loss, bleeding points, furcation, gingival attachment, and a current full mouth series to go along with this code. And when many times when someone will say, well, can I do this, utilize this only if I am a specialist? Well, the insurance company does not care if a specialist or a general practice submits this code. What they care about is what comes along with the D0180 when submitting to insurance.
All right, so Pam, this begs the question. You're bringing up a lot of exam codes.
Okay.
Let's take a look at what's going on here. The whole picture.
All right. So with the ones in green, which is the D0120, the D0140, and the D0150, those are frequently used codes, which is the problem focused limited exam, the periodic exam, or the comprehensive exam. We just talked about the D0160, and Erica asked a great question. We just talked about the D0180, which is the periodontal code. What we're going to unpack, which is the D0170. So the D0170 is an exam code as well. So this involves reevaluation. And so, Erica, this may be a better code to follow because definitive treatment has not been rendered. Sometimes when patients come, the doctor will do an exam and not sure what's really causing the problem and bring them back because definitive treatment has not been rendered. So this may be a better option for your question, Erica. And always trust but verify. Make sure that you get a breakdown. Add this to your breakdown of insurance savings. Now, with the D0170, it's similar to the 160 as far as frequency limitations. Many payers will lump this into the exam, which is twice a year. And then there's some payers that are a little bit more lenient. So always trust but verify. It is a standalone code. It has to follow an exam code and cannot be submitted with another exam code.
So Pam, quick question on the 0180. Can that be used for a perio patient's yearly exam instead of the 0120?
Yes.
Okay, so Madison, that's your answer. I'm looking at the questions coming up here.
Great question.
And that was a question.
There are some frequency limitations. Some payers may allow you to do it twice a year. So you may have to, you can alternate. And with the D0170, I don't want to miss this. You see in the corner where we have miscoded, often the 170 is confused with the D0171. The 171, and this is bonus, is your post-operative code. An example would be if a patient had a tooth removed and you're bringing them back, you would use the 171, not the 170.
Got it. And then I'll just add one more, Pam. I assume that with an 0180, you can include an FMX or a Pano with that, correct?
Yeah. Yes. And Pano today isn't what it was a few years ago. Sometimes the Panos are so intense where you can really see everything in a Panorex that you would a full mouth series. And years ago, that wasn't the case. So to answer to your question, yes.
Perfect. Thank you for that. Next one.
All right. What's new in diagnostic is the D0461. And you wonder why I would get excited about testing for a cracked tooth. It's because it's performed but never acknowledged or submit it for payment. Now there's a code for D0461, which is testing for a cracked tooth. Many times the providers are testing for a cracked tooth and just don't talk about it. There's different ways, which is testing for hot and cold sensitivity, pressure, utilizing staining or transillumination using a light. Cracked teeth sometimes you can't see them. The patient will present symptoms. And so now there's a code D0461. And I love what you always say about this code by the time we get here, Steve, is just because there's an ADA code doesn't mean our payers are going to be excited to pay for it. And I know it feels like this is Christmas without presents, but just hang on, we'll wear them down. And we want you to code what you do and do what you code.
Well, and then the other thing too is for fee for service situations
Correct?
when you're coding what you do, and ultimately, many times if a new code is identified, ultimately that is the indication of down the road
I
there might
agree.
be payment for it. So it's just being accurate. Next one, Pam, is 9936.
So the 9936 is cleaning and inspection of an occlusal guard, and this is per appliance. So this is not to be utilized when you are delivering the occlusal guard. It's when you bring a patient back just to check and inspect to make sure that the occlusal guard is in good standing, and then to clean it. And so you cannot include adjustments with this procedure, especially if you're submitting for reimbursement. It may be denied, but this is a new code that was introduced.
Excellent. Pam, I'm going to just pause right here for a couple of questions.
Sure.
We got a steady flow of awesome questions here. So for everybody listening, we're going to do our best to address the ones that kind of fit in with what we're talking about today. So as an example, for the 0170, I'll give you a scenario, Pam. If this is from Brian Danielson.
Okay.
Patient comes in with pain and the bite's adjusted, and then it doesn't solve the problem, and they come back, what exam code would you use? Is it the 0170?
Yes, yes, because definitive treatment has not been rendered, and there's some language that's attached to the 170 as well. Brian, so great question, which is soft tissue or trauma.
Okay. This one's from Chrissy. Would the cleaning / inspection of an occlusal guard be billable at a prophy / recare appointment?
Yes,
Those can go together.
yes, and always add this to because it's newly introduced. I would whatever the codes that you are getting a breakdown of your insurance savings, I would add that to it so you can figure out so that they can let you know what the frequencies are and if it's payable.
Perfect. Okay, let's talk about, there's a couple of oral surgery code updates we're going to share. Here's the first one.
All right. So there's two that were neck and neck as far as revised. And you'll see the first one is the D7285. This is an incisal biopsy of oral tissue. What the Code Maintenance Committee added was the word lesion, and they gave an example, a cyst or tumor. And this is for hard bone or tooth.
Next one.
The 7286 is the same with the exception of 85 is for bone, for hard tissue. This is for soft tissue. And what was added to this one as well is lesion. So soft tissue, you would use 7286, hard tissue, 7285.
Excellent. Okay, so those are some highlights of the diagnostic code changes. So let me just talk about trends here real quick. We've talked about, when you look at all the exam codes, you look at the salivary diagnostic codes. So much of what we deal with in dentistry, yes, is restorative and perio. So here would be a question to take back to your team, which is, what's your perio percentage? So when you look at your patient base, what percentage of your patient base has a perio treatment code associated with their record? You got to diagnose it first, but then to what degree are you actually treating periodontal disease? Here's a couple of examples. These are statistics from this one for the Centers for Disease Control. Most everybody's familiar with this. They report that almost half, so 47.2% of adults age 30 and older in the United States have some form of gum disease. So some form of periodontal disease, and the numbers go up the older a patient is. So they report that 60% of adults over age 65 have some form of periodontal disease, and that includes 50% of men and 35% of women. So pretty safe to say that every other guy that you have sitting in your chair has got a problem. On average, that's the problem. So when you look at the scope of the problem, this is the most prevalent disease in the world. And Pam, you know how I know that? That's a question in the board game Trivial Pursuit has a question that says, what's the most prevalent disease in the world? And the answer is periodontal disease. So we have that scope of a problem. You got half of adults in America. So if we were doing our job in hygiene and diagnosing and treating it, what would a healthy perio percentage be? If we were nailing it, perio percentage would be at least 50% of patients would have some kind of treatment code, perio treatment code associated with their record. So we got a poll question, Derek, which is
very exciting.
There you go. Does your practice have a written perio protocol? So Derek's going to launch the poll and you get to respond to this. So do you have a written perio protocol? And I'll show you what a written perio protocol looks like. But in writing, do you have a protocol that outlines, when you see these signs and symptoms, what do you diagnose? How do you treatment plan it? So that there is a standard of care in this area in writing that everybody in the practice follows.
We're getting a lot of results in, Steve and Pam, so we'll just give it a little bit more time, but it's a really close split here, which is really fascinating.
Yes.
Give it a few more minutes, couple more.
Keep voting. This
Keep
is how
voting,
Derek.
everyone. This is your opportunity.
This is how Derek tells
Pam
if
can
you're
hear from
engaged
you.
in the webinar or not. If you don't vote, you don't get CE, right, Derek?
That's right. We want you to take part in these polling questions.
You got to engage.
Very important. Looks like we have a steady flow now stopping here. So I'm going to go ahead and end the poll.
All right.
Okay.
As you could see, Steve and Pam.
Here you go, about 50. Yeah. This is very consistent with what we see around the country. So here's an action item. It is a written perio protocol. Now, this is an example of what a written perio protocol, how it's designed. Okay. And yes, I whited out the contents of these because this is not a complete document. This is just an example of how it's laid out. So you would have what the indicators are, and then how you treat the different levels of disease at each visit. This is very detailed, very laid out, so that you're diagnosing and treatment planning periodontal disease the same way. So if you have multiple hygienists, or this is a way for the doctor and the hygienist to be on the same page so that they're collaborating together on a consistent, predictable protocol for how you treat disease, how you diagnose it, and how you treat it. So here's another resource. As I mentioned, we got a number of these. If your practice is part of the half that does not have a protocol, or if you'd like some suggestions on how to update your protocol so that it's in alignment with all the latest research in periodontal disease, you're welcome to scan that QR code, and you'll get access to some of the latest periodontal protocol research so that you're doing this in a consistent way that works for your patients and for your practice. So that's another resource. I got a bunch more of these, so that'll help take your practice in the right direction. Okay, so one other statistic that's very interesting is that 60%, it's estimated that 60% of diabetics have some form of periodontal disease. And the other estimate is that a third of practices or excuse me, a third of patients that are diabetic have not been diagnosed. And one of the first places it shows up is in the mouth in the form of periodontal disease. So this is another trend question, which is, are you addressing whole health issues in your practice? This is the window of wellness right here, and there's so many indicators. So for example, as a suggestion, when somebody fills out their medical health history, and we know the common denominator of disease is inflammation. That's the consistent thing. Any disease is a form of inflammation. So if you have a patient who's checked arthritis, maybe they have a heart condition, maybe if they've had a stroke, the more of those type of conditions they have, they're in a higher risk category for periodontal disease and vice versa. Inflammation is the common denominator. So are you addressing whole health issues with your patients to say, for example, Pam, if you had a patient sitting in front of you that had a number of different issues like high blood pressure, maybe they've had some, arthritis, whatever it is, then to be able to say to that patient, I see that you've checked arthritis and heart condition. Has your rheumatologist or cardiologist, have they ever told you about the connection between that condition and the health of your mouth?
Mm.
Right? Are you having those kind of conversations with your patients to help them connect the dots? So there's a lot of great resources in this area in dentistry that can really help you build a robust, very, very up-to-date hygiene system. This is one of our recommendations. You can scan this as well. This is the TOPS, what we call No More Hygiene course. And the reason it's called No More Hygiene is because its focus is on identifying, diagnosing, and curing disease, not just cleaning teeth. So a lot of patients think hygiene is about cleaning teeth. This is about diagnosing and curing disease, right? So we've talked about the codes associated with this. The practice of how you make it all work, that's a whole body of work in and of itself. So you're welcome to scan that for some resources there. This is the cutting edge, the latest science in the treatment, diagnosis and treatment of periodontal disease. All right, so those are some diagnostic updates. That was our first category. Pam, let's talk about implants and prosthetics. So there are, in this area, 17 new codes that are associated with implants and prosthetics, and 7 changes. So let's take a look at what has changed in prosthetics and implants.
All right. So first in 2026 is the D5877 and the D5878. So this is a duplication of a complete denture maxillary, which is the upper, or complete duplication of the mandibular, which is the lower. I am really excited about this. It's many, many years ago. I witnessed patients who, whether it's a fixed or a conventional denture, whenever they needed a repair or anything that's sent out to the lab, it was a walk of shame out of the office, and they would hibernate at home until their denture was ready. And that was heartbreaking. Today, after a denture is completed, a new denture, you can duplicate it where now the patient will have 2 sets. So in the event that there's a repair along down the line, they have a second set and they no longer have to have the walk of shame. So yes, I got excited about this. Now, payers are a little uncomfortable paying for both dentures. And one of the things that I'm excited about is they got out of the way, which means you can bill the patient. And when you present this to the patient as far as the why, they'll figure out how to pay for it. You don't have to worry about that part. But I'm excited about that this was introduced, the 5877 and the 5878, which is a duplication of a new completed denture. What was revised was 3 codes. The first one, which is 5876, and what was added is the language of adding metal structure to acrylic and the word complete. So now it's a complete denture, and this is per arch. The 5934, the Code Maintenance Committee felt that the resection language was confusing, so they removed that and they added guidance with a guide flange. And a flange is an extension of added to a denture. The 5934, I'm sorry, 35 is a guidance. The word guidance was added, and this is without a flange, so without an extension. And those are the three codes that were revised. What's new is the 5909, and it's the code that I just reviewed, but the difference between the two is the one I reviewed was lower. This is the upper maxillary guidance prosthesis with a guide flange, which is an extension. So that was added. The 5930 is the upper without a flange. So those are the two new codes that were added. The one that was added on the implant services is the D6049. And so this is scaling and debridement around a single implant, which has presence of implantitis or inflammation. And a frequently asked question about this is, can you file the D6049 with an 1110, which is a healthy mouth cleaning? The answer is nada, no. Because it's under the Perio umbrella, what can be submitted with this would be the D4342, which is a Perio code 1 to 3 teeth, or a 4341, a Perio code by quadrants. So either or can be submitted with the 6049. The next, which is the 6196, this is a removal of an indirect restoration on an implant retained abutment. And not to be used for temporary or provisional or a screw retain restoration. And so an example of this would be when I say indirect restoration is the removal of an implant crown or an implant bridge. The next new code is the D6280. This is an implant maintenance procedure. And so this is removal of a full arch abutment supported denture. It's removed, cleaned, and reinserted. And this code is to be utilized per arch.
All right, so Pam, one of the most common questions when we go through different procedures, especially when there's a new code, is what should we charge? So what should we be charging for different, either if there's a new code for it, or just in general, what should we be charging? Well, that answer is specific to your practice and your geography. So one of our recommendations is that at least a minimum on an annual basis, you do a fee analysis to see how your fees match up with what's going on in your geographical part of the country. So at least doing that once a year. Beginning of the year is a great time to do that. So if you have not done a fee analysis for your practice in the last 12 months, here is a free resource. If you're participating in this webinar today, you can scan that code. There's a simple form that you'll fill out for our team at the Crown Council, and they will send you a custom fee analysis based on your geography, where your practice is located, and you'll be able to see the different fees that are being charged in the different percentiles. So this is broken down by lowest to highest, so you can see what's going on in your geographical area, and then make some adjustments to your fees based on what the market demand is in your area. So again, we recommend you do that at least once a year. Pam, quick question on this is from Erica Murray. She said, if a patient's having a 4342 and has an implant, can we use code 6049? Is that correct?
Yes.
That is correct. Good job, Erica. Okay, spot on. So those are some changes that have been made to the codes and implants and prosthetics. What does that tell us? Let's talk about some trends here for just a minute. What are you doing to serve the aging population, right? There's a lot, when you look at the activity that was just done in this area in coding, that's telling us something. When there's a lot of changes in a particular area, that means there's a lot of work being done in this area. And this is why. Not lost on anybody. I'm sure everybody's aware of this, but just to put it in picture format, this is where we're heading in the United States. When you look at the orange and the blue segments in this graph, they are growing. So as a segment of the population, our population is growing overall. But when you look at the percentage of the population age 65 to 84 over the next 10, 20 plus years, that group continues to grow. Last year, it's my understanding in 2025 was the peak of Americans turning 65. So there were nearly 10,000 people a day on average last year, every day, that turned 65. So you do that math. So that segment continues to grow, as well as the older population. We're living longer, which is good news. So here's the trends. 178 million Americans have at least one missing tooth. That's more than half of the population has one or more missing teeth. Huge, huge dentistry opportunity. 40 million people have lost all their teeth. That's a lot. So here's the question for your practice. Are you identifying missing teeth daily? And Derek, we have a poll question for this. So do you have a process in your practice where you're identifying patients coming in that have at least one or more missing teeth? So let's pop a poll up there on the screen. Interesting.
Let's get some answers in for you.
Yes. Yes or no? Do you have a process where you identify missing teeth every day so you can talk to patients about what their options are? So this would be like in your morning meeting to be able to go through and identify, here's the 5 patients coming in today that have missing teeth. What do we get? What kind of conversation? What are we going to do to move that conversation forward and presenting them options of how to address that issue? Missing teeth are not good.
No, they're not.
Consequences.
No, they're not. We'll give everyone a couple more seconds here. We're getting a lot of responses. There seems to be a lot of people identifying, so let's just give it a few more seconds. Please vote if you can. All right, I'm going to end the poll, Stephen and Pam. Pull up these results.
Say,
so
all right, so awesome. 85% yes, 15% no. So fantastic. It's one of the biggest opportunities that there is. Here's another resource in this specific area. Your morning meeting. We call it a morning opportunity meeting. We do not call it a morning huddle. Your morning meeting is done right, strategically, is one of the most important habits of the top teams in dentistry. So this is a resource you can tap into to supercharge your morning meeting to make it strategically one of the most important things you do with your team every day. It is a critical habit, both clinically as well as for case acceptance, teamwork. Got to do it if you're going to perform at the top of your game. So that's a resource you can use to have a more strategically planned, better morning meeting every day. So here's a couple of questions. Are you identifying missing teeth daily? What are your implant options? So what implant options are, you don't have to place implants to be able to provide your patients implant options. You can work with a specialist, neurosurgeon, a periodontist to provide those options. We got half the population that's got missing teeth. Every dentist ought to have implant options available for your patients. And what are you doing to make it easy for patients to afford and to be able to pay for implant and prosthetic dentistry? That's a big, big part of this whole equation, is how they pay for it. All right, so that wraps up implants and prosthetics, Pam. Our third category. So we've talked about diagnostics. Second category is implants and prosthetics. Let's talk about sedation.
Comfort.
There are 6 new sedation codes and 5 revisions. Here we go.
Right. So the 2 new for 2026 is the D9224. This is administration of general anesthesia, and this is with advanced airway. The language with advanced airway was added because this is to support breathing And so this is when a tracheal tube is used, also known as a trach, for the comfort of the patient. The code that follows that is the D9225. This is subsequent 15-minute increments or any portion thereof.
So this one, Pam, if I can just interject here, airway. This is another strategy question for the practice: is what are you doing in the area of treating airway issues? This has to do with sedation, but the whole area of airway is a growing piece of dentistry, and how we're treating sleep apnea, the whole deal. So just a little footnote. We're not going to go any further than that, but another big trend. This is a deleted one, Pam. Tell us about this.
It's in red too. All right, the deleted code D9248. This is a non-intravenous conscious sedation code. This code carried a lot of weight, and it was the umbrella for multiple procedures. So this one, the 9248, was removed, and I'll share with you what it was replaced with, several codes. The first is the 9244. So this is in-office administration of minimal sedation, and this is a single drug. The 9245 is administration of moderate sedation, multiple drugs. So the difference between 9244 and 9245 is 44 is a single drug, and 9245, the clinician may opt to put together a compound, multiple drugs, because every patient and every procedure is different, and some may need more than others. Almost said more drugs than others, but that would not have come out right. The 9246 is administration of moderate sedation, and this is non-IV, and this is for the first 15 minutes. The 9247 follows that, and it's each subsequent 15-minute increments or any portion thereof. Now, all of these can be administered orally or sublingual. The patient is conscious, and they're very relaxed so that it manages anxiety. What was revised is the D9222. The Code Maintenance Committee added the word in bold, which is administration, and they also added 15 the minute increments as well. So this is deep sedation where a patient is unconscious, and this is for the first 15 minutes, which is the D9222. The code that follows that is the 9223. And so it's subsequent 15-minute increments or any portion thereof. There's 3 that was revised, some keywords that were added. The first is 9230. This is your nitrous oxide. The word administration was added, and this is a single agent, which is the utilization of nitrous oxide. The 9239, the word administration of moderate sedation. So this is with an oral or a sublingual drug in addition to nitrous. And the 9243 is the subsequent 15-minute increments or any portion thereof. And so what was added was administration and any portion thereof. And so these 3 codes help you relax before you relax.
So these are pretty significant updates, changes in sedation. So what does that tell us? Well, here's why. The estimate is that there, in one of the most recent surveys that was done in the United States, this was in the Journal of the American Dental Association just this last September. This was a study that was cited that found that 72% of America expressed either moderate or severe fear of either going to the dental office or of a dental procedure. 72%. That's 3/4 of America. It's a lot. So of those who cited fear as an issue, 38% said it was because of the drill, 25% fear of pain, 17% fear of a mistake being made, and 18% because of a previous bad experience. So no surprise here. It's an issue. Sedation is one of the solutions. So Are you addressing the causes of fear up front? In other words, if you got 3/4 of the market that this is an issue, are we marketing to that? Are we addressing it before they ever come in? Are you marketing for that? Are you making it easier with patients with some or a lot of fear with sedation options? So here's another poll. Derek, let's launch this one.
Yep,
How
let's
many
get it fired
sedation,
away.
yeah, how many sedation options does your practice offer? None, at least one, or two or more? So we'll let you vote there. Pam, while we're doing that, here's a question from Christina. Yeah. If Valium is prescribed to the patient for the day of their procedure, can we submit sedation?
And I was just about to type to her. So yes, the question is yes. And Christina, if it's a single drug, so identify if it's a single and not a compound. So yes, you can use that code.
We got a lot of good results coming in here. The question that was posed has one extra option, Stephen, of three
Oh,
plus.
three
So it goes
plus.
from 0, 1, yes. So we'll
Okay.
see how this goes. But there is a really even split here. We'll give everyone a few more seconds before I share the results.
Expand those options. I love it.
Mm-hmm.
And then Pam, just as a follow-up, with the Valium, can they code it even if the patient picks up the prescription at the pharmacy?
That that I would like to confirm.
Okay.
I want to say yes, and I want to trust but verify. Will you allow me to get the answer for that? And at the end, can you share them how we can stay in contact soon?
Yes.
Okay.
Yep. Don, I'll get you a connection here. Okay, here's the results. Wow, pretty evenly split. 21% nothing, 23% at least one form, probably nitrous, two or more, 32%, and three plus, 24%. So pretty even even split across the bank. Thank you for sharing that. So again, this would be an action item of big issue, hasn't changed. This is ongoing. Dentistry gets a bad rap for this. So what are you doing to make it easier for patients to get the dentistry done, make it attractive for them to come in? So that gives you at least some direction on where to go in those three areas. So we've talked about diagnostics, we've talked about implants and prosthetics, we've talked about sedation. We've covered the majority of the changes. We have not there's been, there were a few changes here and there to things that were kind of one-offs. But these are the big ones. These are the ones that show us the trends, where things are going. A couple of suggestions. Number one, make absolutely sure you have updated your practice management software to the latest version. Every practice management software company will load the coding changes into your system. So make sure you have the latest version, that you're using the latest version, so that you have all these codes already loaded into your system. So updating is a really, really good idea. With questions, this is a huge topic. So you're welcome to jot down this email address, our team at Total Patient Service. So you just email answers at totalpatientservice.com. So like Don, for your Valium question, if you want to just shoot us a quick message and just put Valium question, say, hey, Pam, I was the one that asked you the question about if they
Steve,
pick it up.
I have an answer.
Oh, you have an answer. You're quick on the draw.
I researched it. I wish it were yes, because it's at the pharmacy. No, we can't utilize the code. If there are drugs that you have locked up and you administer from your office, then you may use the code. So
Got it.
thank you for letting me trust but verify and get that answer for you.
You got it. Derek, I think we could probably do a 3-hour webinar on this because there's so much to do here. You got a shout out from Dawn, Pam. She gave you a big thank you.
Oh, you're happy to do it, Don.
Here's an additional resource. So we know that the best performing teams train, right? It doesn't come naturally, just like you're doing today. getting some training, some knowledge, some education around coding will increase performance. So this is a gift for all those that are participating today in the webinar. This is a gift from our team at Total Patient Service to your team. You can scan this QR code for a $200 gift card from our team, good toward any virtual coaching topic that we have at Total Patient Service. And those topics include financial arrangements, dealing with patient objections, how to become a yes practice to increase your case acceptance. So there's a vast library to choose from. Best teams and best team members trained. They're always engaged in continual improvement. That's our commitment to dentistry, is to be a source and a resource for teams so that you can hear yes more often from your patients at every point of interaction with your patients. So with those coding changes and the trends and the opportunities that they provide for the future of your practice, we hope that gives you a starting point for an amazing year ahead to grow your practice, code correctly, and continually train your entire team so that you can hear yes more often in every area of your practice. Derek, thanks for being an awesome host today, and thanks to everybody who participated. We wish you an amazing 2026 ahead.
Absolutely.
Lots of opportunity, lots to do. Thanks for letting us be a part of your upcoming successful year.
I'm truly grateful for you. Thank you.
Thank you, Stephen and Pam. And
Welcome.
just a friendly reminder to everyone who's joined us today before you leave. We have our compliance webinar for this month happening next week on 121. If you haven't registered already and you'd like to join, please do so. And you can find all of our upcoming webinars at rectanglehealth.com/events. Please take a look, and if there's anything that interests you, register. Again, do our survey. It really helps us to understand what topics are interesting that you'd like to hear about. And just in general, how are you doing? How you felt about our session today. On behalf of the entire Rectangle Health team and also Pam Peterson and Steve Anderson, amazing guests today from the Total Patient Service Institute, I want to thank you all for joining. You will receive your follow-up email with your slides and a recording for this webinar that you'll get from that. And also the CE credit webinar email will be separate from that as well. I hope you have an amazing rest of your week and take care.